Cut the sugar and up the protein, right? That's according to new dietary guidelines just released by the Department of Health and Human Services. Here's a look at the revised food pyramid right now. The new guidelines suggest that Americans skip eating high-processed foods and focus on eating whole foods like meats, vegetables, fruits. While some health experts question the new pyramid's recommendations to consume red meat and full-fat dairy, Health and Human Services Secretary Robert F. Kennedy Jr. is doubling down, saying a healthier America starts on your plate. Listen.
My message is clear: eat real food. Nothing matters more for healthcare outcomes, economic productivity, military readiness, and fiscal stability.
And officials say these changes, which come once every 5 years, are meant to target chronic disease and set a guideline to, quote, eat real food. Let's bring in a top nutrition expert, my friend, Dr. Gabrielle Lyon, joining us now to explain all of these changes. Dr. Gabrielle Lyon, it's good to see you, my friend.
I'm so happy to see you.
Oh, and we're glad that you're here because I guess one of the big questions is, how are these new guidelines different from what was recommended before?
Well, the old guidelines functioned based on the belief that saturated fat was really at the root of obesity, diabetes, heart disease, and other chronic health issues. However, when that became the belief, it essentially demonized animal-based products. We know that roughly 60% of our nutrients and 100% of our essential nutrients come from these animal-based whole foods. So the fact that they have finally recognized dietary protein, the new guideline recommendation is 1.2 to 1.6 grams per kg, is amazing, and it's based in the literature. This is what is so important, is the rigors that became so valued, the scientific evidence which supports the increase in dietary protein.
As an expert in this field, do you see if there's anything missing from this new pyramid?
Well, missing, I wouldn't quite say missing, but where this pyramid also highlights the need for more research. The current recommendation of 10% or less saturated fat has come into question. But at this time, we don't have enough data to change that number other than shifting from processed foods to getting your fats from whole foods.
I can imagine a lot of parents are watching this. You're a parent yourself, and a lot of parents are probably asking, hey, how's this going to change what we see in schools or other federal food programs?
This is probably the most important aspect of the new guideline changes. The reality that we're going to be able to offer school lunches, children, our military, higher protein options will change the trajectory of their aging, and also from a military perspective, physical readiness. We know that dietary protein is important for muscle health and also maintaining a healthy body composition. The shift towards whole, healthy foods will change the health of our country, and that begins with our children.
And Dr. Lyon, as you speak, right behind you, I see your new upcoming book, the Forever Strong Playbook, which is a follow-up to your other book, New York Times bestseller, excuse me, Forever Strong. So very excited for you, but you have a lot of this information right there. So we thank you for joining us.
Yes, thank you so much. And the new guidelines are reflected in the new Forever Strong Playbook, how to execute.
Oh, fantastic. Thank you so much, my friend. See you soon.